tingling feet, muscle cramps at night, that heavy, dragging feeling in your legs by evening. You might think these are just part of getting older, but they're actually early red flags that your circulatory system is struggling, and ignoring them could lead to blood clots, nerve damage, or even stroke. In the next 9 minutes, I'll reveal 5 warning signs your circulation is already compromised, and the 4 vitamins that can help reverse it naturally, nutrients you probably already have in your kitchen. The first one is vitamin B3, also called niacin, a key nutrient that naturally expands your blood vessels, making it easier for blood to move through your body and reducing the chance of clots or blockages forming. This expansion allows more oxygen and nutrients to reach your tissues, easing common symptoms like leg fatigue and cramping. Niacin also champions heart health by lowering bad LDL cholesterol while increasing good HDL cholesterol, preventing fatty buildup in your arteries. You'll find it in skinless chicken breast, eggs, salmon, tuna, and almonds. Just one 100-gram serving of chicken breast gives you over half of your daily niacin needs. But before we dive into the other 3 vitamins, let me explain what's actually happening inside your body when circulation starts to fail. Think of your blood circulation like a highway system. When it runs smoothly, oxygen and nutrients reach every cell, and you feel energized and strong. But when circulation declines, the early signs are easy to miss. Poor circulation happens when blood flow becomes sluggish or blocked, especially in your feet and legs. The causes include plaque buildup in arteries, weakened vein valves, high blood pressure, diabetes, lack of movement, or simply aging. What makes this dangerous is how quietly it develops. Swollen ankles, cold toes, minor discomfort, people brush these off. But these are serious signals. When blood vessels lose flexibility, the risk of clots increases dramatically. Without proper flow, your body can't flush out toxins, leading to inflammation, infections, and faster aging. Professor Dr. Joel Kessler, a leading expert in regenerative medicine, puts it clearly. Blood flow is essential to every aspect of healing and vitality. Without circulation, nothing functions. The good news is, when caught early, poor circulation can often be managed or even reversed with simple daily changes and targeted nutrition. So let me walk you through 5 major symptoms that appear in a clear pattern, each one more serious than the last. The first warning sign is changes in skin color. Have you noticed your feet or ankles looking pale, bluish, or marked with dark patches? This isn't cosmetic. It's a sign of poor oxygen delivery. These areas often feel cold and heal slowly when injured, opening the door to infections. The second symptom is cramps when walking or at night. A sudden sharp cramp in your legs while walking that forces you to stop could indicate intermittent claudication, a lack of oxygen in your leg muscles from narrowed arteries. Nighttime cramps disrupt your sleep and signal the same underlying problem. Third is frequent tingling and numbness. That pins and needles sensation in your feet, especially after sitting or standing, it's not just poor posture. When this becomes regular, it points to nerve stress from insufficient blood flow. Over time, this leads to peripheral nerve damage, affecting your reflexes and balance. The fourth warning sign is cold feet, even on warm days. If your feet feel icy when the weather's warm, blood isn't reaching your extremities properly. This happens when vessels are narrowed or blocked, preventing oxygen-rich blood from reaching your toes. Beyond discomfort, it indicates arterial problems like atherosclerosis and weakens your feet's natural defenses. And the fifth and most visible sign is varicose and spider veins. Bulging, twisted veins, often bluish or dark, are one of the clearest signs of poor circulation. These form when valves inside veins weaken, allowing blood to pool in your lower limbs. This causes discomfort, swelling, and heaviness. Spider veins, those tiny red or purple lines, are also warning signs of compromised vein health. Professor Kessler warns that the biggest mistake is thinking these signs are purely cosmetic. Poor venous flow is like a silent unraveling. When it fails completely, complications are far harder to treat. If you're experiencing multiple symptoms, consult a specialist. A simple vascular ultrasound can identify issues before they become dangerous. And if you're finding this helpful so far, go ahead and hit that like button. It really supports the channel. Now let's talk about the other 3 vitamins that can restore your circulation naturally. The second essential vitamin is vitamin C. This isn't just for immunity, it's a structural protector of your blood vessels. Vitamin C produces collagen, which keeps vessel walls elastic and strong, preventing varicose veins. It's also a powerful anti-inflammatory and antioxidant that shields blood vessels from cell damage and premature aging. The best sources include citrus fruits like oranges and lemons, kiwi, berries, guava, which actually contains more vitamin C than oranges, and vegetables like red peppers, broccoli, and spinach. Remember, vitamin C loses strength when exposed to light or air, so eating these foods fresh is your best bet. The third vitamin is vitamin K, a nutrient that often flies under the radar, but is absolutely vital for circulatory health. It manages how blood clots, preventing both excessive bleeding and harmful clots that could block arteries. But its value doesn't stop there. Vitamin K also prevents arterial calcification, which occurs when calcium builds up in vessel walls, making them stiff and less efficient. This protective effect is especially important if you deal with high blood pressure, varicose veins, or vascular complications. You can get this vitamin mainly from dark leafy greens like spinach, kale, arugula, and broccoli. A smart and simple way to include more vitamin K in your day is by drinking green smoothies. One effective combination includes kale, apple, celery, kiwi, mint, and a bit of ginger, best consumed fresh in the morning. If you're taking blood-thinning medications, you don't need to avoid these foods. Just keep your intake consistent so your doctor can adjust dosages safely. And the fourth vitamin is vitamin E, often described as the protective antioxidant of the vascular system. It acts as a strong defense against oxidative stress, which contributes to the early aging and weakening of blood vessels. By neutralizing harmful free radicals, vitamin E helps preserve the integrity and flexibility of artery walls, making them less prone to tears and damage. It also assists in preventing blood clots, encouraging smoother, more unrestricted circulation. One of its additional roles is to enhance your body's production of nitric oxide, a compound that helps blood vessels relax and widen, easing the burden on the heart and naturally lowering blood pressure. You can find vitamin E abundantly in foods like avocados, extra virgin olive oil, sunflower and pumpkin seeds, almonds, and green veggies like spinach and broccoli. While supplements are available, it's best to rely on whole foods for steady, safe absorption. So here's what you need to remember. Circulatory issues aren't just minor annoyances. They're warning signs of deeper health problems affecting your heart, brain, and mobility. But you don't need drastic measures. Start with simple swaps. Try a green smoothie in the morning, choose almonds instead of packaged snacks, add dark leafy greens at lunch, pick whole fruits over desserts. These small daily shifts create big improvements over time. Let me give you a quick recap. Vitamin B3, or niacin, enhances blood flow and helps balance cholesterol levels. Vitamin C supports vessel strength by boosting collagen and lowering inflammation. Vitamin K helps keep your arteries clear and reduces the risk of unwanted clotting. And vitamin E defends your vessels from oxidative damage and promotes vessel relaxation for better circulation. Each of these nutrients works in a unique way, but together they create a powerful support system for a more flexible, balanced, and resilient cardiovascular system. If you already have symptoms or a family history of circulatory problems, make sure to talk with your healthcare provider to tailor advice and adjust treatment safely. Take care of your circulation, and you're preserving your independence, mobility, and peace of mind as you age. Before you go, comment below with your age and where you're watching from. We love hearing from our amazing community, and if this video helped you, share it with someone who needs it. Many people ignore these symptoms for years. Knowledge like this can truly change lives. Thanks for watching. Don't forget to like, subscribe, and share this video to help us reach more people staying strong and healthy as they age. Remember, better circulation starts with small steps you can take today. See you in the next video.